Today we study microbiology, chapter sterilization and disinfection. First we know the definition of sterilization. Sterilization is an absolute freeing of an article from any microbial burden including spore. Then we know the types of sterilization or classification or method of sterilization. There are two methods on physical method and chemical method. Physical method has three types: heat, filtration, and radiation. Heat. There are two types of heat: dry heat and moist heat. Dry heat, red heat, flaming, hot air oven, and incineration. There moist heat, below 100 degrees centigrade, at 100 degrees centigrade, and above 100 degrees centigrade. Below 100 degrees centigrade, example pasteurization, vaccine bath, and water bath. And at 100 degrees centigrade temperature, boiling, steaming, and tyndalization, and above 100 degree temperature, autoclave 121 degree centigrade. And radiation, X-ray, gamma ray, and ultraviolet ray. And filtration, Barkfield type, Chamberlain type, and membrane filter. Chemical method. Chemical method, formaldehyde, example glutaldehyde, detergent, ethylene oxide, cresol, Dettol, and phenol. Now we know importance of sterilization in microbiology. First, to make sterile culture media, to make sterile medical and surgical equipment, and to prevent nosocomial infection. Then we know the use of different sterilizing procedure. First, red heat. Here, metallic inoculating wire are sterilized. Then tyndalization. Here, culture media containing egg and serum, sugar, gelatin. Pasteurization and milk and milk product and other beverage. Hot air oven, it's important. Hot air oven, glassware, petri dishes, test tube, flask, cylinder, glass pipettes, swab sticks, oil fluid like grease and powders are sterilized. Ionizing radiation, rubber, plastic, and polythene tube, and disposable syringe, and bone and tissue graft. Ionizing radiation and ethylene oxide, they are both polyethylene tube, rubber tube, and plastic. And glutaldehyde also in rubber, plastic, and polyethylene tube, including disposable syringe, bronchoscope, endoscope, etc. And 5% cresol, sharp instrument, hospital laboratory floor. Sharp instrument are sterile in 5% cresol, and blunt instrument, except sharp cutting instrument, are autoclave. And also autoclave culture media, dressing apron, surgical instrument is called except sharp cutting instrument. Now we study method of sterilization which can destroy bacterial spore. Hot air oven, autoclave, tyndalization. There are three mainly process of sterilization bacterial spore. And other are formaldehyde, ionizing radiation. Now you know chemical sterilant. There are some chemical agent: ethylene oxide, glutaldehyde, formaldehyde gas, and halogens. The most important question is mention the advantage of moist heat over dry heat in sterilization. Moist heat is superior to dry heat due to moist heat have better penetrating power at low temperature. It produces latent heat and it kills the bacteria by denaturing their enzyme and structural protein. And bacteria are also susceptible to moist heat. Advantage Disadvantage is also moist heat. Plastic material fats cannot be sterile. There are chance of explosion chance থাকে. Now study autoclave. First we know principle of autoclave. At atmospheric temperature, water boils at 100 degrees centigrade. Within the rise of pressure, the boiling point of water also rise. Then under steam under pressure unmixed with air has more temperature than mixed with air. Steam under pressure has more penetrating power, so because of producing large amount of latent heat and thus increasing the efficacy of sterilization. It's the use of laboratory use culture media bottle in rubber cap, dressing apron, blunt instrument, and clinical use की water, surgical gauge, blunt surgical instrument are sterilized. There are advantage and some disadvantage of autoclave. Advantage, what is advantage of autoclave? It is a moist heat, so it has more penetrating power, liberate latent heat, and it less time consuming, no charring, efficient sporicidal procedure. It is also killed fully the spore of bacteria, and it is used in dressing apron, gloves, catheter, surgical instrument. Synthetic fibers can be sterile by this method. And disadvantage of autoclave: the equipment is costly, there are chance of explosion, plastic materials, fat, oil, powders, etc. cannot be sterilized. Hot air oven. Hot air oven, it's have some advantage and also have some disadvantage. Advantage: glassware like stick swab, syringe can be sterilized, powder, fat, gauge can be sterilized, and sharp cutting surgical instrument may be sterilized. And disadvantage: more temperature needed, time consuming. Okay, plastic material cannot be sterilized in this process because because uh, pasteurization. Pasteurization may be defined as the process by which milk is heated up to such a temperature for such a period of time to destroy microorganisms within the milk without altering the composition, flavor, color, and nutritive value of milk. There are three methods: holding method, flash method, and high temperature short time method. Holding method 63 degrees centigrade for 30 minutes, flash method 72 degrees centigrade for 15 seconds. Their example: pasteurization, Mycobacterium, Salmonella, Listeria, Escherichia, and Brucella. Now we know tyndallization. Tyndallization is the sterilization procedure by intermittent heating at 100 degrees centigrade. And how we know process of tyndallization? Heating for 20 minutes at 100 degrees centigrade, then vegetative form of bacteria are destroyed but spore remains. So incubation for overnight at room temperature, then germination of spore occur favorable condition. So second times heating for 20 minutes at 100 degrees centigrade, vegetative form of bacteria are destroy, few spore remain. Again incubation for overnight at temperature and germination of few spore, and third time exposure, and all organism including spore are destroyed.